hysterectomy, and ovary can be sliced into small pieces, and ovarian tissue can be cryopreserved. And in males, if they have a testicular cancer or the cancer of the prostate, they will undergo radiotherapy. This will cause atrophy of the sperm producing cells. For males, it is very easy. They have to just give some semen samples and we will freeze it. It's women and children who have to undergo a surgery or an IVF cycle for freezing their material, genetic material. But we should not destroy the dream of motherhood to anybody, because any woman, she feels being a mother completes her life. So let's also be aware of these advancements in reproductive medicine and offer this to all the people around us. Ultimately, hope is life. Let's be facilitators to make everybody's dream of having a child come true. Thank you.
Now the session is open for question and answers. As one question, what are the procedures we will follow during the illegitimate child? Illegitimate child.
Illegitimate child is a child which is born without a marriage.
Whenever the patients come at that time.
Okay. It is after delivery or patient has come in pregnancy?
While after delivery at that time also, and you are admitted also.
Okay. See, these pregnancies that occur without a marriage or illegally, it depends upon at what time the patient has approached us. Recently, you all might have read newspaper, the MTP Act has been, corrected because of one case that happened that there was some disability in a child, but doctors refused to terminate it at 32 weeks. So the whole MTP Act has been revised. It depends on what is the age of that patient, of that girl that has come to you. If she is a minor, if she is not above 18 years of age, we need the consent of somebody major, so probably her parents or her guardian will tell us that this baby has to be terminated, and her consent is also very important, and then we can go ahead with termination with if it's before 28 weeks. And if it is beyond 28 weeks, it's actually not allowed to terminate. But again, the recent revision of MTP Act says that only the girl is responsible. It's her wish whether she wants to continue or does not want to continue. If she has justification that delivering this child will have so many harms in her life, whatever be it, health issue or social issue or anything, if it is justified with another registered medical practitioner's signature, MTP can be conducted. But let doctors not involve into this, because if a person has raped the girl and only the girl and her family comes, they terminate and go. Later that man will come and tell, I would have married her. Who gave you the consent to remove that? So these issues have to be dealt better, in a better way. Proper consenting, detailed consenting in the language they understand has to be taken and then gone ahead.
Thank you.
What is the role of IVF in septate uterus?
In septate uterus?
Yeah.
Okay. So septate uterus can be a complete septum or an incomplete septum.
Complete septum.
Complete septum. Irrespective of it being complete or incomplete, it affects the site of implantation. Because the septum, if there's a pen, I can draw.
Yes, sir. Light.
The normal uterus is like this. A septate uterus will have a septum like avascular tissue which is in the uterine cavity. For an embryo to implant, it needs blood supply for its growth. So usual site of implantation is this 1 to 2.5 centimeters from the fundus, but this septum is not allowing it. So it is very important to hysteroscopically resect the septum, and after 6 weeks you can go ahead with IVF. But not all septate uterus need IVF, sir. After septal resection, if her eggs are normal, tubes are normal, sperm is normal, she can have a natural pregnancy also.
Without detecting this as conceived, what is the prognosis?
It depends on the site of implantation again, sir. Because placenta in ultrasound we see anterior placenta, posterior placenta, low-lying placenta. So if the placenta is situated like this, here there is no good blood supply to the placenta. So she can go into abruption early, or she can go into abortions, or she can have repeated bleed because placenta gets separated here without having support. So there will be a subchorionic hemorrhage here, which she'll present as bleed always. Or if all goes well, if placentation happens here or this side, also if she goes to term, the probable complication she can have is a malpresentation. Instead of cephalic, it can be a breech, or she can have a preterm delivery because this much of space is reduced, so there can be an early delivery.
Thank you.
Thank you all for your patient hearing.
Thank you so much, ma'am. Now I request our next speaker, Dr. Vijayam Dadenavar sir, to take over.
Sir, the remote